Hi, my name's Val Hewison. I'm the Chief Exec at Carers Leeds. We're a third sector organisation providing information, advice and support to carers across the city.
I'm Richard Norton, I work at Voluntary Action Leeds.
My name's Victoria Betton and I work for the NHS in Leeds running a digital health programme called Habitat.
I'm Anna Medill, I'm Professor Anna Medill. I am Deputy Head of the School of Psychology at the University of Leeds.
My name's Penny Wright and I'm an academic researcher in the Leeds Institute of Cancer and Pathology.
I work for a mental health organisation and we were setting up, or had set up, a relatively new service. It was being funded on a pilot basis. One of the things that we wanted to be sure about was that we were going to demonstrate our impact and our successes or challenges, as they might have been, or areas for development with this new service. We wanted to be sure that we were that we had the right aims and objectives for the people that we were trying to support, and that we were measuring our outcomes in the best and most effective way possible. And we've got that framework in place now, and we're quite clear about what information we need to collect, who we need to collect it from, and why we're collecting it.
Well, it was really helpful for us because I think as people who work in the third sector, it's very easy to just stay in that world, and actually we realised that we had a lot more kind of skill and knowledge that we could do something with. It was like two worlds colliding, and it could have been very easy for them to collide and for us to go back to our comfort zone and just think it will never work. But as they collided, we actually came together and started to have a shared language and a shared understanding of what we could do for each other. I think one of the big things was as we started to build relationships, it was never going to happen unless we actually invested some time and energy in finding out what each other did. And we had a belief that it could work. So we set some time, we listened, and we also found out what we could do for each other.
What we propose to do is to work very closely with inpatients and staff to trace their journey through these services, and we're going to use visual methods to do that. So we're going to use photographs and have staff and inpatients use photographs to tell us about their journey, what's working for them, what their challenges have been, to visualise for us what it's like to be them in this novel service, and from that feed back into the service how to improve it, to use the photographs to exhibit the challenges and the courage of both staff and inpatients, and to provide evidence for how this novel service is working.
My involvement with the Hub came about through the Leeds Acts Partnership, which is the partnership between the academic sector and the third sector. My job is around commissioning and assets and resources to support the third sector, so charities, community groups, voluntary organisations in Leeds. And the Acts project has been a way to start bringing some resources from the universities, all three universities actually, in to support the work of the sector, and it's great.
Well, Q-Tool has arisen from a long research programme which the group that I belong to has been building towards since 1996. So we're very interested in electronic data capture from patients. It seems like, parts of the university are very risk averse and weren't keen to help us, but maybe we went to the wrong people because we didn't really know who they were. I didn't know the landscape at all, and the Innovation Hub really has helped us, and we haven't got there yet, but we're an awful lot closer to where we were before, and it's been going on for years, and it's such a brilliant thing. It's a great tool, Q-Tool, and the perseverance of Alicia and the Hub to help us navigate this kind of nightmare has been really great. They've put us in touch with different people, they've helped us get it evaluated. It's just, taken quite a lot of the headache away.
I've been involved in the hub with Alicia giving me lots of advice and support about how to connect with academia and how to get support from the university. So the hub has helped the projects I run by supporting us with evaluation and making connections with the university that have really helped us deliver those projects better than we otherwise would have done.